The shoulder joint tends to be one of the most mobile joints in the body. It's a ball and socket joint, so it sits like this. And because it's a very mobile joint, it allows the shoulder to be moved in lots of different directions. But there's a price with that mobility, and that's instability. So if we get a trauma to our shoulder, or we take our shoulder into a position which it won't go into, there's a risk that the shoulder might dislocate. So here you have the shoulder joint. We've got the humerus and the head of the humerus, that's the ball of the ball and socket. And here we have the glenoid, that's the cavity or the socket of the ball and socket joint. The shoulder joint moves in many different directions, like so. Now when the shoulder's dislocated due to trauma, in most cases the shoulder comes anteriorly. So the shoulder dislocates forwards. It can also dislocate in different positions as well, such as posteriorly. But the anterior dislocation, that's your most common. Following a shoulder dislocation, the patient is usually taken to hospital and the arm is relocated, and this is known as a closed reduction. There are different techniques to relocate the arm, but sometimes the arm will just be rotated and that will be enough to put the arm back in place. Once it's back in place, then the arm will be put in a sling, but after a few weeks the arm does get very, very stiff, and there can be some adhesions that form around the shoulder which limit the movement of the shoulder. So you can expect following a dislocation for the shoulder to be very stiff. Catherine, I'm seeing you about your shoulder dislocation. Can you just explain to me the history of what happened with your shoulder when it was 20 years ago, was it?
Yeah, I first dislocated it 20 years ago. No, it was longer than that.
Was
30 or 40 years ago.
Okay.
30 years ago when I was skiing.
Okay.
And I had a problem with recurrent dislocation, and I did have an operation, and that was 20 years ago, and then a couple of months ago I dislocated it again, and I was just reaching up, doing something awkward really, and it popped out.
Take you forward a couple of weeks after the relocation. Can you explain the symptoms that you had in your shoulder, the symptoms that you were left with that other people might also experience?
Okay, well obviously after I dislocated, or when I left hospital, I had it in a sling, and they said rest it, don't do anything with it, sort of thing, just and obviously when I took the sling off, it was very, very stiff, and I couldn't really move it very much.
Shoulder dislocations occur due to trauma. So the first dislocation will usually be on a sports field, rugby, in football or hockey. It can be an impact with another player, or it could be a fall. Older people might fall over as well, and there's a risk that they could dislocate the shoulder. So we need to have a blunt trauma to the shoulder to dislocate it. However, once you've dislocated the shoulder once, it's possible that the shoulder is now unstable, and there's a risk that it could just dislocate again. So we see patients coming back having reached in a funny angle, or they've slept funny and turned over, and the shoulder's just dislocated for virtually no reason. Soon after your dislocation, once the shoulder has been relocated, we want to start some passive range of movement exercises. This is where the help of your physiotherapist or osteopath comes into place. So you can work with a rehabilitation specialist, and they'll show you the exercises to do to improve your range of movement. Passive exercises are brilliant, and there's 3 which you can use straight away, and they'll be shown shortly after this clip.
This exercise is a great way to passively mobilise a stiff shoulder. This is an excellent mobility exercise for stiff and painful shoulders. This exercise will help improve shoulder mobility.
Exercises are a brilliant way to improve range of movement in the shoulder. Once you get the full mobility back in the shoulder, then you start doing some strengthening exercises to strengthen the rotator cuff muscles around the shoulder joint. The one big complication following shoulder surgery is that you end up with something called a frozen shoulder. Because the shoulder has taken a lot of trauma, The body literally just tries to compress the capsule and forms scar tissue and adhesions around the shoulder, and that grossly limits your movement. It's a big problem and it can take several months to get full movement back, but you should work with a physiotherapist to help you restore that range of movement and do the exercises every day. Don't expect your shoulder to be perfect after a dislocation. If your shoulder comes out again more than 2 or 3 times, you might need to see a consultant to consider surgery.